Yeah, no worries. It's just, you didn't want to see them on any video first.
Who's that, Christine Scott?
I think she was just the person getting
Who's that, what?
She was the person getting tested. Just in the
Oh.
video.
No, we're not here previously. Shoot, I'm gonna kind of a time.
We're on a public street, so legally we're okay. It's not like you got to pay it.
She did say any of me. She didn't say any.
Right, that's me.
Another call. And getting the phone call.
I have to say, the debates you guys did with JTN and Santa Ross.
Oh, thank you. Yeah. It's nice to collab with them.
Yeah, no, I think that's a great way to do it.
They have a great facility for this event.
Yeah, that's what I haven't been up since they've
Yeah.
redone it, but it looks like it's really nice.
Oh, yeah. Their video studio.
They're heading over now.
Okay. You gonna get tested?
You guys know you can't get shots of patients getting tested.
Of course.
Right.
Yeah.
No license plates or anything.
Yeah. Our cameras are Yep.
Yeah. Feel free to get video and photos from far away, but just don't go there. It's worried about privacy concerns. That's fine. And we'll probably just have the lieutenant governor here answering questions. If you want to talk with the county executive afterwards, he won't have to hear the guy. Cameras.
Yes.
So he comes to work at
Yeah.
So everything's in Jamestown.
Pretty much, yeah.
The Warren guys are in Jamestown?
No, they're still working out. It's pretty much, we're all kind of working out of different kind of guy, but you know, the kind of people are kind of working.
Are the papers all printed in Jamestown?
Yeah.
We don't know if they're-
They have to do it before.
That is stringing for the most part, and the Observer's still printed. It's up in front. The Warren
been
paper,
within the last-
the Warren paper wasn't printed out of Jamestown.
Yeah, it's been within the last, God, I got there in December. So, yeah.
So the people that deliver the Observer are from down in Jamestown. Or do they bring the papers?
I have a feeling
Yeah,
I have a feeling, yeah.
take it away.
Hello, everybody.
Morning. Hi.
Thank you for.
Somebody gonna be able to hold mics or no? Matt. I'm sorry. Matt, would you be able to hold the mics?
Yeah, I can hold the mics. Yeah. Grab that.
I'm gonna.
Keep our 6 feet.
Any other
compliant.
mics at all? You good? Let me just get my phone ready.
All right. Hello, everyone. I'm Lieutenant Governor Kathy Hochul, and I'm here in Mayville in Chautauqua County to have the opportunity to get a briefing from County Executive Wendell and his Public Health Director Schuler. And I had a briefing for about a half an hour, had an opportunity to assess the situation here in Chautauqua County, as well as to have a conversation about state resources being deployed here. I also wanted to personally see one of our testing sites. We have one similar up in Dunkirk at the other end of the county, but this is a place we're able to do rapid testing. People can call for an appointment and have the results back really within 15-20 minutes. And the tests are being run right here. And I want to commend the Public Health Department here in Chautauqua County for the extraordinary work that they're doing to make sure that public health is protected, to make sure that we can have more tests conducted. And I'm encouraging members of the public to make that appointment. It's not hard. I just had one done yesterday. This is not painful. It's just a few seconds of your time to have that assurance to know that when you interact with your coworkers or your family members, that you are safe, that you've tested negative. And so if you want to visit someone in a nursing home or a hospital or any gathering that you're going to have, Thanksgiving coming up, you want to make sure you're safe. So we're encouraging everyone, don't wait till you have symptoms. I have to tell you, there's a lot of peace of mind knowing that you're testing negative. So we have a great site here. I want to thank the county executive and see if he has any comments to make, and then we'll take a couple of questions.
No, I'd just like to appreciate Lieutenant Governor. She's been a huge partner for us, with us throughout this pandemic, and we can't say enough. I'm very happy that she came down and saw. We had a very great conversation as to what's happening here in Chautauqua County. And the same point, we've talked about our numbers being low. Then we need to prove it. We need everybody to get tested. We need to show people our numbers are low here in Chautauqua County. So I'm urging everybody, please utilize the free testing we have here. Get tested, and we're able to show ourselves and the governor that our numbers are low here in Chautauqua County. We're doing the right things by wearing our masks and following social distancing, and really keeping this at bay. So I appreciate the governor's time coming down here and spending time with us and looking to see what a great job we've done here in Chautauqua County.
Mark, did you have a question?
We'll open up to start with Mark there.
It seems, Lieutenant Governor, that early on there was a big emphasis on issues in Erie County and Niagara County. Now we're slowly seeing that shift to Chautauqua, Cattaraugus, and Allegheny County. Do you see that shift as well? And if so, what do you attribute that to, and what can be done to fix it?
Well, the good news is it's not community-wide spread. We've been able to identify specific places. For example, a nursing home here that's responsible for over 70 of the cases. We also were able to identify a workplace situation up in Dunkirk a month or so ago. So that's the beauty of our strategic targeting here. We call it micro-targeting. We can identify the specific areas where the clusters are occurring, do the immediate contact tracing. Again, I give all the credit to the county public health department for tracking down individuals who may have been exposed, and then we quarantine them. That's how we're going to stop the spread, but also making sure that they have the resources they need. That's why we've sent more test kits here. We've sent more testing machines, these rapid testing machines that were in short supply not that long ago. We're making sure they're here in places like Chautauqua County to make sure it doesn't go beyond these specific locations and spread to the larger community.
The only follow-up I have is you're making the same stops in Cattaraugus and Allegheny County. I unfortunately can't join you in those spots. So let's start with Cattaraugus County. What is your message to Dr. Watkins as we go into the more rural areas of the state? Let's start with him.
Yeah, remind people that as much as we're getting tired of this, and the public health officials are doing an extraordinary job. They've been at this for 8 months now. and to support your local public health officials and to let them know that we are here to give the resources you need. So if there is a hotspot, a cluster in that area, we'll be there to jump right on top of it and contain it. But I want to send a larger message to all the residents of Allegheny, Chautauqua, Cattaraugus counties, the entire southern tier, which is now experiencing some vulnerability. It all comes down to whether or not you're wearing your mask. And as you get together with your families, indoor dining, and all the activities where we're moving from outdoors into indoors, this is what's going to drive the numbers down. And the good news is when the numbers go down, more activities can be opened up. We now can have our ski resorts open. We're going to be able to have theaters open. We're going to be able to have more indoor dining available to people. So we want to get our economy going once again, but it's only going to happen if people stop being complacent and start wearing their masks again.
And lastly, your message to the residents of Allegheny County. We had the Houghton Rehabilitation Center, as you mentioned, sort of a cluster there. What is your message to Lori Ballingy and her folks in Allegheny County?
Well, first of all, thank them once again for doing an extraordinary job. These public health officials are the unsung heroes, the leadership that works so closely with the county leaders, as well as the professionals, the aides, the nurses, the doctors who are out there doing this work day in and day out. They get exhausted and they just need a little bit of a pat on the back to say we appreciate what you're doing. So I want to first of all say thank you for being such great partners to the state of New York. We could not do this without you. Also, let us know what you need. If you need more resources, more testing kits, we are there to be the conduit. That's what our control room does so successfully. I hear from these leaders all the time. Every other day we're on a call with that list of what they need, and we are responsive to that. So I just want to let them know that we're there for them and continue doing the great work that you're doing.
Thank you. Lieutenant Governor, today you met with Executive Wendell and Health Director Schuyler. What did you talk about? What were some of the concerns, some of the topics that were discussed to help Chautauqua County combat COVID-19?
Truly asking the people on the ground, the county executive, our public health administrator here, what's happening? What are you seeing on the ground? Where are the spikes? What are you doing with the contact tracing? What help do you need? How are the testing sites going? And what we're hearing, that they have a strategy in place. It's working, but we need more people to be tested. That's why I wanted to come out here and let people know you just literally pull up in your car. You don't even have to get out of your car. You make an appointment, you show up, you take 30 seconds of your life to get that result that is going to give you, again, the peace of mind to know that you can interact with your family and friends in a safe way, and especially with the holidays coming. Don't plan a Thanksgiving dinner, a gathering, without being really smart about social distancing, wearing the mask, and by all means, go ahead and get a test. It's free, it's easy, please do it.
One more question then?
Lieutenant Governor,
I think he had a question.
the movie theaters that I toured, the Reginald A. Theater and the Gibson's Theater in Lakewood, have gone to quite extraordinary lengths to change their interior for social distancing, protective plexiglass, and yet the governor has said that they will remain closed even as other theaters open. Has the governor toured, or have you toured any of these theaters? And why would the theaters be closed when things like the Comedy Center are open? Why are the theaters less safe than Walmart, Wegmans, etc.?
Well, there's many, many reasons why we've been listening to public health experts about the most high-risk activities. And in their words, not ours, a setting where you're indoors for at least an hour and a half, 2 hours, sitting among strangers, no fresh air coming in, ventilation, that presents a riskier situation. The experts tell us that. But we're willing to have a reopening on a graduated way, a smart way, as we've opened up all the economy and have a lower percentage of people attending. About 50 people can attend. Now, the situation with the 3 counties of southwestern New York, in fact, the southern tier, is that at the time the governor was making this announcement, the infection rates were higher than we were comfortable with. And we have said that if you have continuous 14 days where it's under 2%, all of them will be able to reopen. So all the work that they've done, and I've been to those theaters many times. The Regina, I was just there over the summer, stopped by to see what they're doing as we talked about the businesses that are coming back, despite the fact that there's still pandemic going on. So we know they're ready. I appreciate what they've done, and it's just a matter of time as we all work together in these counties to drive the infection rate, keep it below the 2%. We're in a good place today. The numbers are looking very good. Let's keep that going. Thank you, everybody.
Just one more. There was a report yesterday that Pennsylvania might be added to the travel advisory. What's your message? That will affect a lot of people here on the borders.
Yeah, I want to check the veracity of a report. I think it was just media speculation.
Sure.
Nothing official from the state government,
Sure.
Nothing official from us. So everyone got excited about some media speculation on that. However, certainly we watched the numbers, but the governor addressed the challenges of having contiguous counties like states like Pennsylvania, New Jersey, and Connecticut, where there's such interaction. I mean, there's an interconnectedness that you don't have with other states, and so we've been working together, and that's not that's not something that has happened thus far. And all I'm doing is asking everyone to make sure that they keep wearing the mask and social distancing and being very smart, and hopefully our neighbors in Pennsylvania are doing the same.
We'll have to wrap it there then. Thanks.
Thank you.
Thank you. Yep.
Get that back to you. Make sure you sanitize that.
Yeah.
Thank you so much.
Christine, is there anything you wanted to add?
Thank you.
Next week, you can go online to the State Health Department's website to register for those sites. Monday through Friday, 10 to 6 at each location.
I have you hold this for a second. I'm sorry.
You want me to sing karaoke?
I can get it. I can get it if
Please
you
don't
want.
start singing.
I can.
Oh, no, I can't. No, I can't. We have additional, thanks to the state support, there'll be additional rapid testing sites in Jamestown and Dunkirk next week, Monday through Friday from 10 a.m. to 6 p.m. Go online to the State Health Department's website to register for either one of those sites. And I must say that I'm really thankful that the Lieutenant Governor came today and met with us and just had an open conversation about how things are going, what we need, what we're lacking, how we feel. And I'll tell you, that is the first time that I think as a public health official that I have felt heard, and that we have felt that the governor's chambers, is reaching out to who really are the true frontline workers for over 8 months now, day in and day out, without a break, 24/7, and that is your local health department.
I was going to ask you what your reaction to the meeting was today. So you found it to be helpful and positive, even though it was only a short meeting?
I think so, and I think that the Lieutenant Governor recognizes more clearly how hard local health departments across the state, and even the state health department, is working, and that we can't be forgotten when you talk about the frontline healthcare workers in hospitals and emergency rooms and nursing homes, which are phenomenal and doing excellent hard work every day. But public health has not had a break from this since the end of February.
I know the Lieutenant Governor mentioned that she wants to see more testing done. Why is that so important here at the county level?
Well, I think if you look even nationwide or worldwide, so much is dependent on the denominator. So the larger your number is in your denominator, and you have more people testing negative, you're going to have a lower infection rate. If your practice in an area tends to be only testing those who have symptoms of COVID-19, you're going to have a higher infection rate because more of those people are going to be positive than the general public, who very well could be testing negative, and that makes that denominator larger. So, kind of it's basic math if you want to think of it that way. It is. The more people you test that don't have symptoms, that aren't feeling sick, the more people you're going to find that are testing negative. But a test is only a point in time. There's a 14-day incubation period for COVID-19. The test you get today tells you that you're negative today.
And Christine, just the process for us, maybe, if someone was coming here to get a test, they signed up, what can they expect to see?
Well, as you can see, no one's here at the moment, so it's a good time to look at our site here. They come in, They're verified their name, their contact information, so we can reach them. They pull forward to the nurse or the paramedic, whoever's on duty, and it's a nasal swab, so it only goes about 1.5 inches inside your nares, and a several times swab in each side. Then that's put right back down into the specimen container it came in, and then those specimens are run over across the street up here to our public health lab, where the analyzers are all set up and run all day long while we're doing the testing initiatives. So instead of making people wait for those results, we call them within 2 hours of the result. So when you come up and you get swabbed, you're going to be instructed that you must go home, isolate until you hear from us. And then we'll go from there depending on what your results are. We're not having people wait for their results here just because we can swab a lot more people. That way, we can really get a lot more people tested if we don't have people waiting and having to have the analyzers out here. They don't function very well if they're not in a controlled environment. They're made to be inside a hospital, a clinic, someplace where they're out of the weather and out of the elements, and they're very sensitive to temperature, moisture, that sort of thing. So the safest, best place for them is in the controlled lab upstairs. And I think that we're very confident of the results that way as well.
And then I just had one question for Executive Wendell. Sir, the conversation today and testing people in the county, does that help us go forward with reopening once we kind of gauge what's happened? I know we've talked about that before.
Right. I think that's the point we made today is that, we're saying that our numbers are low, then we need to prove it. People that are, if you're, you want to get out and get tested. We need to show that our numbers are low here in Chautauqua County. If you only come and get tested when you're sick or symptomatic, then yes, if you test 5 people, as we said, it's basic math. If you test 5 people, 5 are sick or have symptoms and 4 of them test positive, then our infection rate's 80%. So we want people to show that we don't have those high numbers here, and the best way to do it is through that rapid testing. So great conversation today, great dialogue with Lieutenant Governor, but the urgency is we need to have people tested, and we need to prove that our numbers are low. The best way to do it is have the test.
And she mentioned movie theaters in 14 days if we can get our numbers back to where the state would like them. Do you feel that movie theaters then could reopen in that time period?
I believe that's what we're looking at. Yes, okay. We want to make sure that we get those numbers down so we can get those open. But again, in a safe manner. We're not, as the governor said, this is done in a safe, controlled manner. This isn't reckless. This isn't let's just open and show us the numbers are low, show the infection rates are down. But there's a lot, and like she said, they listen to a lot of the scientific data that's proven why there's some reluctance with movie theaters with so many people that you don't know for long periods of time in a confined space. So there are a lot of setbacks for theaters, but I feel confident in our discussion today that we're moving in the right direction when it comes to our theaters.
Did you raise any?
Yep.
Okay.
Is what the governor's office is looking for movie theaters.
Did you raise any specific concerns in your conversation with her? I know you guys talk often in the control room. Did you feel, Christine mentioned that she felt heard. Did you kind of
certainly
feel that?
And I felt that way all along. We have I have a very good dialogue with the Lieutenant Governor from the very first. The night before I declared our state of emergency, she called me at home, and I've always had an open dialogue, so I feel very confident we're heard. We did voice concerns, some things that have happened here, current situations now, and I believe that we are being heard. And with that being said, this is a case of we listen to one another, we work well in our control room, and I think it's indicative. We've got to the Lieutenant Governor gets that information back and make sure our voices are heard. That's confident.
What are those concerns? What are some of those concerns?
Well, again, just our testing, the ability to get out and get our testing done, and some of the questions we had. My concerns were, what our infection rate was, and looking at numbers. But just wanted to reassure, the governor that we have a cluster. We're looking at that. We monitor that from the very beginning. You look at how we progress with it. If we look at Fieldbrook, we look at SUNY Fredonia, and now with Tanglewood. We're on this. I feel aggressively pursue the matter, and we control the situation and make sure that the spread is not out in the community. So she understands that, but I like to give confidence and a praise to our public health officials. I mean, with our health department, without them, would be in a completely different situation. They've been nonstop from the very beginning. So everybody who works in our county health department has been a phenomenal, instrumental role, and we need to keep up the good work. So that's it. All right.
Thank you, guys.
Thank you so much.
We've been inundated with questions about Pennsylvania.
Yeah.
Thank you. And I think where that stems from is when you look at the infection rates, what the governor's office is looking at as far as the two metrics when a state is added.
Right.
Pennsylvania's been edging up closer and closer to being added to that advisory, and people are getting very nervous when they see that happen. So I think that's where this is all coming from. So we've got our epidemiologist, Bree Agate. I have her running the numbers.
Yeah.
So we also, kind of know where we're at and where Pennsylvania is at because it is so close to us, and the interaction is tremendous. The governor's office has deemed that, for instance, all school staff, including school nurses, are non-essential. So, that could be a huge issue as far as staffing for our county schools.
Right.
So it's very important that we really keep our eye on that and then get guidance from the state if, Pennsylvania is added to the advisory. If not yet, we just have to watch the numbers and see what happens. And there again, Pennsylvania increases their testing numbers so that their infection rate goes down by testing more people. That will help their numbers.
So in this case, it almost seems like it was, their rate went up. That's why the state was monitoring it. And, we saw news reports in Buffalo yesterday that, it qualified to meet the metrics, but it's not on the list currently.
I don't think it's quite met the metrics.
Okay.
It's still below the state's level to be added to the advisory. I've got, like I said, Bree's checking on that today. So I think the governor has a press conference at 11:30. So who knows?
Right.
We don't ever know what he's.
What if it is placed on? I know we don't
What if?
speculation or what if, but if it is placed on, what kind of an impact will that have on Chautauqua County?
If Pennsylvania is added to the travel advisory, I think it could have a tremendous impact on our businesses. Anyone who lives in Pennsylvania and works in New York, who's deemed an essential employee by their employer, can still come into New York to go to work, and then would have to go back home to Pennsylvania. So that doesn't include public events or shopping or anything else. We have received no guidance at all yet on what would that mean if you live in New York and work in Pennsylvania. That is still a big unknown out there. I don't know. And until we get guidance from the state, we don't know. It's not a local decision.
Right.
It won't be local rules. It will be state rules.
Yeah.
So I'm just hoping that Pennsylvania's infection rate and their rolling average stays down.
You don't want them in the state anyway, right? You don't want them. You don't want those people in Chautauqua County.
What people?
By those residents, people from Pennsylvania bringing it in and back and forth, right?
Well, I think we have to. If you can go on the Johns Hopkins website and you can see county per county across the nation what the infection rates are, and the states that border Chautauqua, Cattaraugus, Allegheny counties are very rural. You've got a lot of national forest there. So their infection rates have been very low when it comes to our bordering counties in Pennsylvania. Erie County's been a little higher, but it's more of a metro area. So it's just a matter of the numbers. People are back and forth between Pennsylvania every day, all day, every day. Yeah. That state line means nothing. It really is, people are driving back and forth all the time. So.
Are you worried?
Am I worried? Yeah. I think I am worried just because we are interconnected with Pennsylvania. We have a lot of people who live in this county and they work in Erie, Pennsylvania. They work in Warren, Pennsylvania, Bradford, Pennsylvania, and vice versa. And we have to be able to maintain operations of our businesses, still with keeping people safe. We have to be, I would like to be able to look at things at a county level and infection rates in counties versus looking at the entire state. Because if you look at the Harrisburg or Lancaster area and you look at the Philadelphia area, you see the infection rates are very high in those metro areas, but not when you come up here to rural Pennsylvania. So I hope this doesn't turn into, the one size fits all and it's a blanket and it's the whole state like it has been with every other state, because that could cripple a lot of people.
Thank you, Christine.
Sure.
We appreciate it.
Thanks.
Thanks, Jeffrey.
You're welcome. frozen.
I know, right?